creative and think holistically across and systems. We're not going to touch on everything today, but what we're hoping is that this session will be able to showcase some of the innovative examples and thinking through ways on how we can better support prevention programs and how we can prioritize different funding sources for startup costs or sustaining service delivery. I also want to mention, while today's call is focused on different funding streams, there are some opportunities for one-time funding available, specifically around Family First and prevention. We have a funding opportunity that actually just closed at the end of last month, but there are future rounds available. And that is about tapping into Family First transition funding. And the opportunity is specifically, it's open to anyone and around prevention services. We have a couple other opportunities coming up that are more on the placement side of Family First. But if you are interested in applying for some one-time funding for startup or for expansion of efforts around prevention, please know that that will continue to be available. I think we set it as over 3 years. So we just finished year 1. So it'll be another 2 years of funding available there for you to think through as well. And so with that, I'm going to turn it back over to Heather, I believe, to talk through the wonderful, wonderful implementation guide that she played an amazing role leading and designing for us. And yeah, I'll kick it over to you, Heather.
Thanks, Yumiko. And I always forget to introduce myself, y'all, but I work for the Colorado Human Services Directors Association, and I support counties with Family First implementation. Work very closely with Yumiko and Angelina pretty much every day, trying to manage the county-state interaction. So I'm going to be facilitating our panel shortly, but a couple things that I did want to highlight first are some sections in our Family First implementation guide that we shared with you guys last week, but are relevant to today's topic. So in this prevention services section of the guide, the very last action item, if you scroll down to the bottom of this section, is explore funding opportunities to build a continuum of prevention programs. And it was really in pulling together the information for this action item that we started thinking about wanting to host a conversation like this one we're having today, because there are so many funding sources across the system that vary in how you access them and when, who holds the program knowledge for them, and how often the opportunities might be open. So for most of the sources here, we were able to add individual contacts to reach out to for more information and just some more updated timelines about when funding opportunities open and things like that. So please know that this part of the guide specifically is a resource available to everyone after this call, and we definitely welcome ideas for how we can continue to build this type of information out. And one other plug that I'm going to make quickly is I'm going to go to our Juvenile Justice section of the guide. And there are some really great resources and information in here about opportunities regarding services and approaches that are working well specific to preventing out-of-home placement, re-entry, and further involvement in the child welfare and juvenile justice systems. So right here, there's an amazing resource, this Family First Juvenile Justice Crosswalk that Gretchen Russo put together, and it really highlights some great ideas about prevention touch points. And then in the first action item in this section of the guide, there are a couple of links to some survey response summaries here that we did recently through the Juvenile Justice Work Group and some others that really highlight local best practices around prevention and intervention efforts specific to the JJ population. So it might be a really good resource if you're thinking about collaborative discussions with local partners about funding. So I'm going to switch back to our PowerPoint, and we're going to shift now to our main event. We have an incredible lineup of panelists who are here today to lend their expertise on this concept of blending and braiding funding. And we won't be able to touch on all the funding sources that we'd like to today, but we picked out several to discuss with you all with the time that we do have. And to kick us off, first, our panelists are each going to walk through an overview of some different funding sources and speak to some general guidance around flexibility and how to decide which ones to use when. And then we have 3 targeted questions for our panelists before we open things up for audience Q&A. At any time, I do just want to mention, please feel free to put your questions in the chat and we'll get to as many as we can afterwards. And I also really want to encourage everyone to just have fun with this. I know there's going to be some questions that we can't answer today, but we do commit to following up and getting responses afterwards. And with that, I'm actually going to stop sharing my screen and pass it to our first panelist, Joe Homlar, to talk about child welfare funding sources. And let's have each panelist introduce themselves as we go from there.
Great, thanks, Heather. Wonderful to be here, and it's great to see so many familiar faces and folks that have been involved in this work for a long time. And I got to say that what I love about this platform here on Google is that it's easy to raise a hand, it's easy to go off mute and ask a question. And I would certainly say that if there's something that I mentioned or something that should maybe prompt more clarification, or even something that I have wrong, please, go off mute, weigh in, raise your hand, because we're all part of a community here. And so just want to appreciate everybody's wisdom, expertise, and points of view. And thanks for hosting, Heather and Yumiko, and thanks to the other members of the panel. Speaking of lifelines, we may be asking them a thing or two as well. So my name is Joe Homlar, so it says Joseph Homlar on my name there, and that's my email. So it's joseph.homlar@state.co.us. I'm the Child Welfare Division Director with the Office of Children, Youth, and Families at CDHS. And I've also served a number of years in counties as a child welfare social caseworker, supervisor, department director, and division director in a large county and deputy in a large county as well. So spent a lot of time on the county side looking at statutes and spreadsheets and trying to figure out creative ways to support innovative work. And so hopefully people get inspired from this conversation and think about creative ways to serve kids and families. A couple of things. I would say too, if I have a couple of minutes here, Heather, you're thinking 2 or 3 minutes, does that work? If 2 main takeaways, 2 major resources for folks on the phone, and if it's novel, or if it's not novel and it's redundant in your work, I apologize. But sometimes every time you go back and take a look at these things, new things pop out. And so again, two major resources for everybody on the call. One is Title 26. Title 26 is the Colorado Revised Statutes Human Services Code. A lot of folks on this call are child welfare practitioners, and so we know about Title 19, the Child Welfare Code. Very, very important to take a look at Title 26 because it provides the authority for the State Department to supervise and administer social services. And for a large part, for many of us, that means providing that authority to county departments of human services and providing county departments the resources they need to carry out federally and state mandated programs and state mandated programs. So have a look at Title 26, dig into that, and it's a great source of learning. Secondly, I would encourage folks, if they're not on the list, and probably have to apologize to my colleagues in settlement accounting, to get on the monthly settlement accounting spreadsheet that's emailed out to human services directors and a number of Colorado Department of Human Services staff. And it gives the county by county rundown of all the major allocations that we'll be talking about as panel members. What counties are allocated, what the current month spending is, and then how much allocation is left at the beginning of till the end of the state fiscal year, which ends in June. A couple things to remember. An allocation is not a budget. An allocation is a guarantee, if you will, that if a county spends up to that amount, they're reimbursed in most cases 80% of all those costs. So a county spends $1, and if those programs meet the requirements of the program, they're reimbursed by the State Department 80 cents. About 50 cents of that is federal funding, about 30 cents of that is state funding, and the county's 20% match or 20 cents match is what what they sort of initiated and paid in. I'll start with a couple of main allocations here in child welfare. We all know about most of us know about the child welfare block. The child welfare block is just under $340 million of total funding, federal funding, state funding, county funding, and it resets every year, July 1. And the child welfare block serves the needs of Title 4B and Title 4E. When we think of 4E, we think of the Social Security Act, reimbursement for the cost of providing foster care, adoption assistance, kinship guardian assistance. In Title 4B, we think of protecting and promoting the welfare of all children, preventing abuse and neglect and exploitation, and supporting at-risk families. And in Title 26, there's really a list of child welfare services that are allowed to be invested on, and reasons for counties to pay for such services. It's child protection, risk assessment, permanency planning, and in many cases prevention as well. So that citation is 26.5.101. So that's a little more information about how the block can be invested and spent. Other lines that relate to child welfare. My colleague Matt Holtman is going to be up on the panel next or soon. He's going to be talking a little bit more about core services funding. That's included in the settlement accounting tab. We also have the Chafee programs, and there's a lot of folks on the call that can give a lot more information about Chafee. Right now, we have $1.3 million of Chafee funds, in addition to $800,000 in pandemic relief. If there's questions about that, there's folks on the call where I can get a little bit more about Chafee funding. Essa Funding, so Every Student Succeeds Act, was a few years ago, and that's largely for transportation and keeping kids in their homes, their schools of origin. And then Senate Bill 242, county staffing, which is building up roles of caseworkers to make sure that workloads is level loaded with the staff that we need. 242 started 6 or 7 years ago, and there's been funding every year. I think this year is about $25 million for bringing on new staff to level load. So Heather, I think that's kind of the rundown here. I'm more than happy to get into further details, but I don't want to take too much time, so I'll pass it over to you to introduce the next panel member.
And I'm just going to pass it right to Matt.
Yeah, no worries. Thanks. I appreciate you both. So I'm Matt Holtman. I am the CAPTA and Federal Funding Administrator with the Division of Child Welfare. Excuse me. And talking about CORE. So like Joe intimated, CORE statewide funding. We got into a lot of detail on CORE at the last Lunch and Learn. I think Angelina will post the link to that meeting. But this is, it's $56 million of statewide funding. There is a lot of opportunity for CORE. I think a lot of people are very familiar with it because it has been utilized for over about 20 years now in Colorado. All counties fill out CORE plans. We review those every year. But there's a lot of opportunities for CORE in looking at Family First and looking at prevention services and looking at how we can, maybe look at CORE in a different way than we have. So I think there's just a lot of opportunities with the CORE funds, and we're really excited to see how counties begin utilizing those in the landscape of Family First. So if there's any questions, I'm going to pass this right along to Katie with CMP.
Hello, everyone. Thanks, Matt. As Matt said, I am Katie with the Collaborative Management Program. The Collaborative Management Program, as Joe explained a little earlier, is an allocation that is provided to counties who participate in the Collaborative Management Program. They do receive an incentive fund every year, and it's up to each county to develop processes or choose to have what we would consider like a flex funding opportunity. But if they were to develop a policy and to utilize their incentive funds for flex funding, then there are many opportunities for them to be able to blend and braid those funds with many other payee or payer resources. Some caveats being that they do have to be the last payer of resort. We do want to make sure that we are utilizing our community resources and as well as insurance or Medicaid as much as possible. But the creativity and the flexibility of utilizing CMP dollars, if again the county chooses to have a flex funding opportunity, is a lot more broad than some of our other system partners. And so we can get really creative as long as they're linked to reducing system or further system involvement for children, youth, and families. So I'm happy to talk a little bit more about what that can look like if you have a CMP county as we get into the Q&A section. Heather, I don't remember who I'm supposed to pass it to. I'm sorry.
Andrew with Tanf is up next.
Andrew, I'm going to pass it to you.
All right. Thank you, Katie. I'm Andrew Rauch. I'm going to go through probably a more lengthy introduction in the sense because I'm not in the Division of Child Welfare. So I'm the senior legislative fiscal person in the Employment and Benefit Division in the Department of Human Services at the state level, which is a fun way of saying that like I oversee the TANF program for the state of Colorado from the financial side. So like what I'm really working on is just getting like a Superman style shirt that just says TANF guy on it for the introduction next time. So Heather, I'll try to do better. So the TANF program is, one of the programs that's highly flexible from a federal standpoint, and generally has a lot of different interactions with different programs, from child welfare to child care, to some of your other employment programs, to just the general TANF program as it exists. So there are a couple of, 4 purposes of the program: just generally provide assistance to families so that children are able to be cared for in their home or in the home of relatives, end dependence on government benefits by promoting work, reduce incidence of out-of-wedlock pregnancies, and engage in formation of 2-parent households. So within the federally defined purposes of the program, you can sort of see a lot of areas for overlap between other areas that are like child welfare or child care. Through this presentation, I'll probably just refer to TANF as TANF, because in Colorado, we call it Colorado Works, or CW for short, and that can very quickly get confused with child welfare. So to try to distinguish the two, I'll just refer to it as TANF. It's a pretty high level eligibility program. If somebody's able, family, child in the home, expected mother, income under $75,000, and Colorado resident, like you can generally be eligible for TANF expenditures. So there's a lot of flexibility in the program built into its design. So I would just sort of highlight those couple of things as just the setup for it, that, it's a very flexible program. You all get an allocation, sort of as Joe was talking, each fiscal year. Unlike the child welfare programs, it's an 85-15 split, where it's 85% federal funds, 15% county funds. And counties can actually do some different things with their funds if you're able to separate your federal funds and county funds to yet increase the flexibility that you have within the program. So it's sort of the rubber band of federal, public assistance programs, that you can stretch it in a bunch of different directions to benefit whatever population you're really trying to benefit, as long as they meet sort of that base level criteria. So, I would sort of say, like, I'm happy to answer any questions about it. I'm sure that we'll get into some things going forward. But it's, that flexible program, or, as we were talking about, a toolkit, sort of the putty to, putty over some cracks if there's an issue with another program. So that's the TANF program in short, and looking forward to being part of the conversation today. And Heather, I believe I'm passing to Carrie and other Andrew. Not that that's confusing.
Hello, thank you. I'm Carrie Gaitan. I work at the Office of Behavioral Health. Andrew Gabor is one of my colleagues in OBH, and I don't know that he was able to join. But I'm the Finance and Contracting Director, and so wanted to come and have the opportunity to speak with you today about what some of our funding sources are overall, before we get into any specific questions. But OBH, Community Programs Division, so separate from the mental health institutes, normally we have about $250 to $260 million of funding that generally funds specialized programs for behavioral health and substance use disorder treatment and prevention. And then also specifically focuses on families who are below the 300% poverty level, or they have Medicaid, and then there's certain services that are needed that Medicaid doesn't cover. And actually, I'm sorry, I do see that Andrew Gabor is on. So Andrew, do you want to introduce yourself as well?
Yep. Hi, everyone. I'm Andrew Gabor. I'm with the Colorado Office of Behavioral Health as well. And I'm the Family First and Youth Services liaison for OBH. And we'll be talking about different aspects of OBH funding and what we can do when child welfare is not the first funder.
So just to share a little more generally about our funding, I guess noting first of all that we have received a lot of additional funding this year for behavioral health, both from the federal government as well as the state government, which has increased our awards, basically more than doubled what we would normally receive in awards for a year. So there is a lot of additional funding coming in for behavioral health. A lot of our core programming goes through our safety net, so into community mental health centers, again, for covering all of the catchment areas throughout the state. Secondarily, we have the managed service organizations, which focus on the substance use disorder side of the needs. And then we have administrative service organizations that provide for the crisis services throughout the state. And then specifically on some other areas that I'd want to mention that are noteworthy for new funding, and in some cases shorter term funding, would be through Senate Bill 137. There were a few areas that are specific to children there. Noteworthy within that, a $9 million grant program for counties, and that we will be putting out a request for applications for that here shortly. And then in addition, there was $5 million set aside specifically for the crisis system to focus on children. And some other areas within that are interesting relate to workforce development as well. So there will be some additional training programs funded through that, specific to families and youth. And then just another area of our funding, a couple other areas that are one tied in with Medicaid is Special Connections, where that is with parenting or pregnant women struggling with substance use disorders. And then a couple of federal programs like First Episode Psychosis or FEP. So a few areas that we have specific to child and youth area. And Andrew, is there anything else that you want to mention?
Sure. There's also the Children and Youth Mental Health Treatment Act. That one really pertains to child welfare in pretty major ways, and then also has a wide provider network. So the providers on the phone can certainly use that program, where it's really designed to prevent child welfare involvement. So if the county does not have custody of a youth or child, but that youth or child may need services both in the community and or residential, then the Children and Youth Mental Health Treatment Act can help, as long as the child also doesn't have Medicaid. So it's those commercially insured youth that usually fall through the cracks because commercial insurance has denied or is unable or unwilling to pay. So there's also, Carrie, did you mention the Momentum program? No. So there's the Momentum program, which that is a program designed to help kids and adults, for that matter, stay out of institutional care. So it was designed initially for adults leaving the state hospitals. That has since expanded to children that are stuck in the hospital. And so we are happy to provide more information and contact information for those contractors, but they have pretty flexible funding and can serve Medicaid and non-Medicaid populations in a variety of different ways. And yeah, there's again, like Carrie said, a lot of funding opportunities coming up. I encourage everyone to stay on the CDHS website regarding funding awards or funding opportunities, because both from OCYF and OBH, there'll be a lot coming out in the next several months, for sure.
Thanks, Andrew. And I think we will pass it to Aaron.
Thank you. Hi, everybody. I am Aaron Miller. I am the Family Strengthening Director out of the Office of Early Childhood. And I just want to share with you some funding opportunities that we have in our office, and then specifically talk about two that are under the Family First Prevention Services. So a couple of funding opportunities that are available to counties and to community organizations is Promoting Safe and Stable Families, which is PSSF, and Colorado Community Response, which is CCR. So Both of those programs just went out for solicitation recently and are going into a new 5-year funding cycle. And so unless we had additional funding come into those programs, we are locked in for the next 5 years into those contracts. So, you know, kind of mark your calendar at some point that that funding will become available. But those priorities for PSSF, we have 10 funding priority areas, things like intensive case management, and then there's some programs we fund under there, parenting education, like nurturing fathers and nurturing parents. So if you need more information on our funding priorities there, I would certainly be able to share that with you. And then the priority funding for Colorado Community Response is for those counties to send referrals to the program that have either been have closed assessments, either a high risk assessment or a FAR assessment, and screened out referrals. We did open up the pathway just a little bit this year to say that we would take referrals from the provider agencies, a small percentage of their caseload. So 25% of their caseload can be referred outside of child welfare by the local CCR provider agency. But the two that I really want to talk about a little bit that are funded under the Family First Prevention Services Act for our office is Nurse Family Partnership and Safe Care Colorado. Nurse Family Partnership receives about $24 million annually, and Safe Care approximately $5 million. So we did an exercise to think about the candidacy definition and claiming for those two programs going forward. And we estimated, based on what we knew, we could probably claim about half of the Safe Care families into the claiming pool for Family First, and approximately about 2% for Nurse Family Partnership. So Nurse Family Partnership is funded using master tobacco settlement funds in all 64 counties. And so the reason that we're estimating 2% is we don't have all of the data, and we're only looking at pregnant and parenting foster youth. So that number could go up or down potentially based on when we start claiming what that looks like. For Safe Care, we currently fund 13 sites across 40 counties. It's all state general fund. And, you know, there's lots of talk about expanding Safe Care statewide, which would be fantastic. But we haven't received an increase in state funding for Safe Care since its inception in 2013. So we would have to be looking at other ways to augment Safe Care and working with our partners to see if, you know, Tanf reserves, maybe was there a way to get core services funding, which we're not sure. That's the best at the moment based on some restrictions there. Some reinvestment of the pooled Title IV e-claiming funds, and then, you know, philanthropic partners providing opportunities for both local and local county and community organizations. So if there's things that you want to think about that you might want to be able to do or start doing now, is, you know, start building those relationships with those organizations in your community. Start thinking about the candidacy definition and how do we get eligible candidates into those programs. Both very good programs, and two that we can claim reimbursement for under Family First. So I'll turn that back over to you, Heather.
Thanks, Erin. And thank you to all of our panelists. It's actually really exciting to have everybody in the same meeting together and just see all the various programs that span our departments and agencies. So I have 3 more quick targeted panel questions, and then I see some great questions coming in the chat. So first question I have is for Katie and for Matt. And I was wondering, I know that you guys have some recent examples of when you've seen creative ways of blending and braiding core, local CMP and or local CYDC funding for prevention specifically. So I was just wondering if you could speak to a couple of recent examples you've seen.
Yeah, sure. I'll start out and then send it over to Katie. So in reviewing some of the core plans, which all of those know that those are already due, so it's nice to see those coming in. And reviewing county core plans, we're seeing CMP actually written into some of the core plans. So that's one, I think, one opportunity. I also see we have counties reaching out some really creative solutions on how to help move those services towards the front of our intervention and our involvement. For folks that don't know, core service programs, they're in rules, so they're in volume 7. 19.1, 119 is kind of where it sits. And it talks about like home-based intervention, intensive family therapy, life skills. There's a lot of different categories I'm sure many people are familiar with. these really do mirror a lot of the family first conversations. And so I think it really is counties looking at this in a new way and kind of looking at those services that CORE already says we should be providing or spending this money on, and then what programs are already in existence. So I know there's a little bit of partnership with Aaron over at OEC for some of the, how do we partner for small pieces of certain programs that they have or specific pieces so we don't actually overlap or duplicate, but make sure that we're all kind of, like you said, blending and braiding and moving that same direction. Katie?
Yeah, thanks, Matt. So like Matt said, well, I'll back up just a little bit. For all counties until that they decide to make a change, the Department of Human Services is where the money is allocated to, and if there's another fiscal agent, then it moves over. But for a lot of our counties, it remains in their local DHS accounting. And so we see a lot of counties utilize this as a way to make blending and braiding core contracts or even service providers a little bit more streamlined. And so examples of this will be if we do have a prevention family, or we're trying to prevent further system involvement, or we have multiple system involvement, we're trying to prevent that as well. That we'll see CYDC, CORE, and CMP perhaps split services like an MST service where each will agree to pay for 1 month, and really see that blending and braiding and cost sharing for services for the families, obviously going through Medicaid and private insurance first. Obviously, we want to make sure that we're still the last payer of resort. Other examples with just CYDC and CMP would be to blend and braid together to purchase a respite bed, maybe through Shiloh House. I know Douglas County does that through their Alternatives to Detention program. So that's a really another great way to utilize preventing the utilization of detention, preventing DHS involvement from a family. And so I do think that there are really a lot of ways where we can get creative within our systemic funding sources to provide services to children, youth, and families with a no wrong door policy more effectively and efficiently. So I have other examples, of course, Heather, but I don't want to take up too much time. But I do also know that there's a ton of CMP coordinators on the call too who could easily provide even more examples of ways that their county has chosen to utilize their flex funds, again, if they have the ability to do so, and a way to blend and braid with their system partners.
Thanks, Matt and Katie. I'm going to go back to Tanf Guy and also Joe. So Andrew, you mentioned that really helpful analogy you always use to describe TANF as a rubber band. And I just want to give some more opportunity for you and Joe to talk specifically in the weeds about what it means for TANF to be flexible and some of the nuances depending on how you stretch that rubber band. And Joe, for you, with your context of experience in Park County and just being able to use TANF in different ways too.
Yep, thanks, Heather. I think, you know, one of the things I'd like to highlight sort of out of the gate as it relates to blending and braiding with TANF is for programs and other, you know, services related to child welfare, child care, you know, other things, TANF can either be directly expended on those services or you can transfer for those services. So the distinction is if somebody's eligible for the TANF program, sort of that high level eligibility cap, and they're, you know, based on an assessed need, they can be provided a supportive service. And that supportive service is sort of, you know, in between the basic cash assistance, which is sort of the meat and potatoes of the TANF program, then the administrative side of things. The remaining funding can sort of be used for these other, you know, supports that families need to help them attach to employment. Or at least that's sort of the design of the program as it was intended. I heard Aaron say earlier that, you know, some of his programs haven't had their funding levels change since 2013. TANF's funding hasn't changed for the state of Colorado since 1996. So we're still sort of playing in the same, you know, appropriation that we had from the feds way back then. But within the program, if you have somebody who is TANF eligible and needs child welfare services, you can provide that funding through the TANF program directly to that family. And this can be done in a couple of ways, whether it's, you know, through some of the, you know, supports that were mentioned earlier around prevention, caregiver, options, looking at other things like, service coordination, independent living services. We have a CFMS code line that basically is additional child welfare services. That's literally what it's called. So it just sort of highlights the fact that there's a lot of flexibility within the program. Then on the transfer side, the feds, when they created the program, allowed states to transfer a certain percentage of their federal dollars each year, either to their state child care program or sort of a split transfer between their state child care program and their child welfare program. So up to 10% of the state's federal TANF block grant, which is 136 million, so about 13.6 million each year, could be transferred by a county to their child welfare program. When you transfer that money, it sort of changes the color of that money, and you're now playing by the child welfare rules. So if you keep it as a direct expenditure within the TANF program, you're playing within the TANF program rules, and you can sort of adjust based on eligibility, reassess services every handful of months to try to skirt around the 4-month cap on a supportive service payment. But if you transfer that money, you're then sort of playing within the other programs set of statutes, set of rules and regulations. So that's highlighting both the flexibility within the TANF program and the flexibility to move money across the TANF program line. So I also would now pass to Joe if he has other examples or things from the county level, and then I'm sure we'll have some other questions that I've also seen in the chat related to the TANF program.
Andrew, that was a great rundown. Thank you. I'll just add a couple things. So we think about the TANF allocation to provide a couple things. One is staff salaries, personnel costs, and then costs for basic cash assistance. What's remaining can be invested in possibly in more global ways. When we think about the child welfare block, we think about how are we serving the child and the family involved in the open case, and how are we tying this intervention to the child and the family's family services plan. So it's a little bit more of a one-to-one connection in the child welfare block for the most part. With additional TANF dollars, if there are any, that's where conversations start with county commissioners, human services directors, local agencies, and other community leaders to talk about, and families obviously, about are there opportunities to invest in communities where we don't have that right now, whether it's potentially domestic violence services, parent support services, young or first-time parents. That's what, after those conversations, you bring your ideas back to Andrew, you talk about the plan, and Andrew guides you through, do we reimburse on a pro rata basis families who make less than $75,000? There might be a number of those enrolled in a parenting program, for example, and some that are not. The ones that are enrolled and are eligible, you get reimbursed. That's a TANF eligible program. For the others, there might be other types of community funding that you would need to make up that difference. But the idea is to talk with people around opportunities and then bring those ideas back to Andrew, back to Matt, back to Katie and Aaron about those next steps and how brainstorm ways to draw down the funds that might be sitting on your plate.
Thank you, Andrew and Joe. So for our last panelist question before we open it up, this one's for Andrew Gabor and Carrie, if you want to jump in, as well as Aaron. So I wanted to just have an opportunity for Family First evidence-based prevention services specifically. If you guys could walk us through a couple examples of how to consider primary and secondary funding sources. And then, if possible, I think, Andrew, you might be able to touch on what Medicaid as the payer of first resort means in context of services like multisystemic therapy, like functional family therapy, and also Child First, which is just starting and going through the Medicaid process and all of that right now. So any context that you guys can give for Family First specific services.
Sure. So through the state plan that Angelina has been working on and many other stakeholders have been speaking to, there are set services through Family First that are eligible for reimbursement. However, when counties are looking at behavioral health interventions, it's important to know what funder should pay when, right? That we don't want counties to just be the default funder, that really they should be the last funder. We don't want families having to either get involved or even have the county take custody only because the child needs, or and the families need, behavioral health interventions. The first thing is that if they have commercial insurance, they're buying that commercial insurance, they're paying for it, and so the commercial insurance should be outreached. Even though it might seem like an automatic dead end, it should absolutely be outreached. Commercial insurance, they have appeal processes. Sometimes those can be convoluted and time consuming, but it should still be used. If they do not have Medicaid, they should also look at the Children and Youth Mental Health Treatment Act if the commercial insurance is not a viable option. All right. And then and only then, after that is no longer an option, or for some reason that dependency and neglect action is taken, then the county can look at or should look at funding. If the child has Medicaid, again, having a strong relationship with your local regional accountability entity, your RAE, should be a top priority for your county leadership, or if you're a provider, for your provider leadership, to make sure that you have a good relationship with them. Medicaid should absolutely fund behavioral health interventions if it's within their scope prior to the county. So again, if they're unable to pay for behavioral health interventions that is still seen as necessary, then go down that route. So if you have MST, multi-systemic therapy, there's lots of different funding options. You can look at, again, see why MHA can pay for it, see if commercial insurance has someone within their network that can pay for it, and if not, then look at getting reimbursement from 4E funding through that route. That's a very, very quick snapshot from my perspective. Carrie, Aaron, well, I didn't talk about Child First because that's a early childhood thing, even though it's mixed funding at this point.
Yeah, did you want me to jump in there, Heather, now and talk about family Child First? Yeah, so some opportunity for Child First. Currently there's federal funding being provided through Office of Early Childhood and Office of Behavioral Health, and some philanthropic support to build the infrastructure here in Colorado to make that program available to families. There are 4 initial sites serving the Denver metro area and San Luis Valley. And the model combines home visiting and in-home mental health services for parents with children under 6. And so, thinking about that again, are there ways that we could identify or braid other funding? Maybe it's, core services, or maybe TANF dollars again, but how do we maximize or bring in extra funding to be able to support this program going statewide? That's one example of some braided funding that we're currently using, and I was looking to figure out how we can expand that even further. I have one other example. Did you want me to share that now, Heather? We have one other example of, a good place where we have braided funding currently. So parents as teachers, which is also eligible for Family First Prevention Service claiming. The Office of Early Childhood provides federal funding. So thinking about that in the larger picture, we can't draw down or we can't claim on federal dollars that are being provided to support a program. We can claim on state dollars. And so the OEC is providing some federal dollars to fund parents as teachers. State funds are being paid to support parents as teachers through TGYS. So we could draw down on those dollars. Our intermediary Parent Possible uses state dollars for their funding. And then, there's foundation and donor support for parents as teachers to sustain these programs. So in this model, no one site has 100% funding from one single funding stream. And, from our perspective, programs would be better off if we could braid the funding to create sustainability. It helps us to expand services. And, the other things, again, that we would like to consider and figure out is how do we maximize TANF funding and core services dollars. And then, with the trust fund, when the trust fund is putting out solicitations to fund programs in Colorado, that will be of pooled funds that we will use when we draw down the Family First Prevention Services dollars. And that will allow us to expand services and to pay for services that are covered, through the clearinghouse and that are in Colorado's plan. So that pooled funding is probably, we're estimating, about a year out before we would have enough money in that fund to be able to start putting out solicitations to fund other programs or to expand services. So that's kind of our perspective and how we can braid some funding throughout Families First.
Amazing. A huge thank you to all of our panelists who very bravely volunteered to make this discussion possible today. I see lots of great questions in the chat, and Angelina is a rock star at doing this, so I'm going to turn it over to her and open it up to answer some of our audience questions.
Great. And just as a heads up, Heather, I am documenting everything. So if we want to put it into a format that we can send out with the follow-up, that would probably be helpful for folks, at least the documentation of what's been responded to in the chat and the questions themselves. So we did have a question for Tanf guy, Andrew. What happens if a county overspends TANF allocation? What happens if a county underspends TANF allocation?
Right. Apparently, I need to change my Twitter handle. So that's a great question on TANF and what happens when you over versus under expend. TANF, by federal law, is allowed to carry a reserve. And Colorado is in the minority of states. That's a state supervised county administered TANF program. Most states administer it at the state level. So we pass along a reserve allowance to counties. So it's in statute, and as Joe mentioned earlier, the Title 26, the Red Book that we refer to, that caps what a county can roll forward in their reserve at either $100,000 if your county allocation is under $250,000, or 40% of your TANF allocation if your allocation is over $250,000. So in the case of an over expenditure, you would draw from your TANF reserve, and that would be sort of the money that you use at closeout that comes out of your county TANF reserve. If you underspend your allocation, you can bank into your county reserve up to those statutory limits. Now, once a county hits their statutory limit, we go through a couple of processes to adjust funding to redirect to counties who are below their county limit. And then the funding, if everybody's at their cap, flows into the state's long-term reserve, which the state sort of uses as a little bit of a trust fund to help fund some of these over expenditures or other expenditures related to the TANF program. I think, for instance, the child welfare refinance that the Joint Budget Committee engaged in this past year, where they used some TANF dollars and used those as direct expenditures in the child welfare program instead of some of the general funds. So they were able to adjust that money comes out of the state's long-term reserve. So that's sort of what happens when a county's over. There's an adjustment mechanism tied to the reserve, but that also, I think, highlights, unlike some other programs where you're trying to expend down to the penny about your, to your allocation, if you blow past your TANF allocation, you have your reserve to draw from. And then the other thing that I would just mention is counties can buy and sell TANF. So there's a transfer market within the program that if you are overexpended and you reach out through the CHSDA is very much involved in this process. CCI, the Colorado Counties Incorporated, is involved in this process, or you can reach out to me and we can facilitate trying to find a county who's willing to sell some of their TANF allocation to a county that's overexpended. That does come with an MOE swap. So if you're buying, you're agreeing to take on the 15% share from the other county that's selling. But those are just a couple of the options that I think are out there that can sort of limit any concerns you have about trying to get exactly on the nose of your TANF allocation each year.
Thank you, Andrew.
For saying that I could jump in after Andrew was done talking. So I have a few questions. As far as each of the funding sources have their own rules and are tied to those rules of each of the funding source. So for example, core services has to be tied to a child. So I guess I'm unclear, and I have missed out on some of the family first conversations, I will readily admit, is that how can you blend and braid these funds when they each have all their rules of the funding source that you have to follow? And then if to create these programs or make these programs happen, if they are provided by a community provider, then how are we counting those kids and drawing down those funds? Is that something that's been determined? I just am unclear. CCR is a perfect example. It's usually by a private provider in a community. If we're trying to draw down funds for the child welfare agency, they don't have to necessarily provide us that data, and it's not in trails. So has that been fixed and I missed it?
So there's a couple layers to that question, right? Absolutely, the goal of Colorado's broad definition of candidacy was to allow the opportunity for outside prevention service providers to provide services and us be able to claim for that, right? So we linked in the first session to the Colorado Lab Report, which is talking sort of having you, I'm going to have Yumiko talk about that because she knows more about it than I do and can speak to the details of it, but it talks about sort of the implementation plan across the state, accessing services, what the sort of best way for us to approach that is. So there have been lots of conversations, like you said, Tiffany, about for youth and families who are accessing prevention services outside of involvement with child welfare, we don't necessarily want their information to be in the trail system, and rightfully so. So there's been lots of coordination. For example, Erin Miller and I have had many slightly painful conversations around data collection and ensuring that for example, the programs that fall under OEC, they are collecting the data that we need in their own systems through their own programs. They will then essentially we're going to merge at this higher level, that is CDHS, which is the Title IV agency. So we will merge data at that point and then submit to the feds for reimbursement. So right now we have it figured out for our internal DCW, our CDHS as a whole. The next step is to have the conversation about those providers that are completely outside of any of those programs. And essentially, they're going to have to collect the same data, provide us the same information. It will look similar to how Erin and I have coordinated with OEC, right? It'll just be a coordination either with their intermediary. So for example, functional family therapy, which is on Colorado's currently submitted prevention plan. I have had conversations with FFT LLC, who is right like the group that stands up FFT at specific sites. And we've gathered so much information and data from them, and we've provided them the list of information that they would need to submit reports to us in order to claim for their services. So it'll look something like that. It's just I think of it as like the expanding circle, right? And then Yumiko, I don't know, I'm not sure if you're still on. I'm hoping you are. And if you could talk a little bit, or if you want to talk a little bit about the Colorado Lab Report that recently came out. I know we mentioned it in the last call, and it doesn't look like she is on. So I'm calling on her and she's gone.
I was also just going to add that a lot of states have also been talking about that very question that Tiffany asked. And I think that in the session next week, in talking about like provider requirements and what this is going to take for candidacy, there's an acknowledgement that we're going to do the low-hanging fruit in the short term. And then we also have our longer-term vision that we'll be building towards once we get our feet under us and kind of move that direction. So I think just trying to figure out all those various pieces that we still have to stand up and figure out data and things like that. It's just very real.
And again, I think the reminder from the first session of the Lunch and Learn around when we say the ability to draw down funds for prevention services, those funds are going into the Children's Trust Fund, right? And so absolutely, like we want to stand up services. We want new things to come on board as we're going further and further into this process and looking out into the future. And I think language is very important. And so absolutely, the Title IV agency will be drawing down funds for the provision of prevention services, and those funds will be added to the Children's Trust Fund, which will be available through a grant process. Right, Erin? I'm hoping you. That's true. Okay.
Yep, that's correct.
Thank you for verifying that for me. Okay,
Angelina, you muted yourself.
Thank you. I'm glad you could see that I was still talking and I muted myself. Okay, so we did have a question around, and I'm not sure, Andrew and Carrie, you'll have to help me out here if you think we already addressed this, but there was a question about hearing more about how OBH will strategically distribute their new funding opportunities based on gaps analyses, needs, etc. Also, how can OBH support the creation of behavioral health services in communities that need them when that might not be in the wheelhouse of the county departments?
Yeah, that is a great question. And if any of you are familiar with Senate Bill 222 out of the 19 session, that is something, probably one of the most strategic things we've been working on. We did a recent population and needs study with HMA as one of our consulting partners, and are working through establishing the Behavioral Health Administration now. And that is absolutely one of the primary focus areas, is really answering those questions. How do we design out the state's behavioral health safety net? What are the requirements of such a system? And then how do we partner with counties and jurisdictions to actually implement that, and consider that, you know, the counties are different themselves, and that a lot of that information is included in the population and needs study. And we've also recently published the 222 implementation plan. I actually reached out to Camille Harding during this call. She's was our division director for OBH community programs and has moved into a new role for the strategy and innovation officer, and really heading up a lot of this effort for us. So following the call, if there's any particular documentation or resources that she recommends that we send out, I'll send to our facilitators here for distribution. It could be very content dense at this point in time. In the interim, I would just say that one of the other shorter term and more immediate ways, if a county does have a more immediate need, would be through the $9 million grant program through Senate Bill 137. And again, we will be putting out a RFA, or request for applications, on VSS, or vendor self-service website, for counties to go ahead and apply for those. And there's a committee that's being built to decide on distribution of that funding. And then if there's resource needs in terms of designing out what would make the most sense for the county, you know, that's something that we can definitely talk more about as well. But it's definitely something that we have awareness of, that we'd want to be supportive of in partnering with counties.
Thank you, Carrie. Okay, I'm going to jump to Lexi for her question, and then we'll jump back. I think we can get maybe a couple more of the ones that were in the chat. And I just want to remind folks, Heather and I will coordinate. We're going to get all of the responses and questions together, even the verbal ones, and we'll send that out to you in the follow-up.
Thanks, Angelina and Carrie. I appreciate your response, and also Andrew's in the chat to my question. But I guess my concern is that the counties may be able to identify a need for behavioral health services, but that's not necessarily their expertise or their role to actually create the services themselves. And we know that in many parts of the state, we have workforce challenges and other challenges to actually sustain some of the services that are truly needed locally. So I'm curious too if OBH is exploring perhaps state-created services around behavioral health, maybe paying higher salaries to incent people to move to certain parts of the state, or to pay for beds that aren't used and things of that sort. And I don't want to take up all the time, so feel free to answer that question in the chat too. But I'm really looking for ways that we can creatively fill the gaps in more rural parts of the state that don't rely on just an already existing provider applying for a grant that might not be, you know, truly transformative or sustainable.
Yeah, Lexi, great questions. Those are, I mean, the $9 million county grant program is awesome, but it's actually small compared to some of the other more major funding sources that have come through federal stimulus, as well as the Senate Bill 137, which is also federal money, mostly the ARPA money. But for example, you mentioned workforce issues, which we know is a barrier. Like we can have all the money in the world, but if there are no employees available to enter the marketplace at that wage, it does us no good. We have received $18 million in that particular bill this session for workforce development. And so there's areas around not just training, but funding for educational types of things, and just looking at ways to expand the workforce. And then a lot of other areas where we know that it's not going to be the most economical or the best design for every single county to go develop its own RCCF or detox center or whatever type of resource. So those are definitely things that we know that the state needs to look at systemically, and the population and needs study is a big help for that. Again, looking at maybe a group of counties or an area of the state where one particular issue is of greatest concern, and then us having to partner with the other organizations in the safety net, or expanding the market and looking to new providers, or helping to develop new providers or resources to bring more providers in to meet that need that can't be met with existing resources. So we definitely understand this is a barrier, and that's absolutely what we're working towards under that Senate Bill 222 and the Behavioral Health Administration.
All right, so I'm going to jump in. I know there were quite a few questions for our TANF guy. And Andrew was nice enough to put his email in the chat. I would also say Heather and I are happy to coordinate. I know we have about 5 minutes left, so I want to jump into this question. There were a couple questions and comments around CCR, our Colorado Community Response. Where would folks get more info on that?
Yeah, so for Colorado Community Response, just to be clear though, it's not one of the programs being offered under the Colorado Plan for Family First, but they can contact our office. Probably the easiest way, and I'll put it in the chat, you can contact our new program manager, Caitlin Lammy, for more information on the program.
Thank you, Erin. That's helpful. Let's see. And I see, Andrew, you captured one of the TANF responses. So I appreciate that. The home visiting one, great. Thank you. So there was, I think this is a nice one to sort of close out on. There was a comment. It's nice to see that many funding streams have a lead or expert at the state level. As a friendly reminder, county staff often don't have that privilege, especially in small counties when a few people are responsible for understanding and executing the work to access all these different funding streams. So there was a second comment, if there could be a training that happened periodically to talk about the different funding streams, especially that were applicable for child welfare, early childhood, and TANF. That would be awesome. There's a historical knowledge that may no longer be current in some counties. Depending on and updating would be fantastic. Often counties ask other counties. So I think that's a great sort of ending place for us to be. And I'm not sure if any of our panel folks would like to weigh in on that. I definitely think that would be a great resource and can help bring that conversation up. But I want to give our panelists a chance to close out on that.
You know, to jump in real quick, Matt, Katie, there's a legion of Division of Child Welfare staff on this call right now. We are always happy to help and talk through things that come up. And these platforms, these virtual platforms, make it very easy. And so, you know, I don't want to speak for Andrew, Aaron, anybody, Andrew, the other Andrew, or Carrie, anybody else, but let's get together. If you have an idea, let's find a way to make it work. In my experience, the creativity lies in the folks that come together and come up with great ideas, and that's really the challenge. I think the rest of it, trying to figure out how it works, that's what, you know, they can lay that problem on our plate, and we're more than happy to help.
And I would say the same is true for the Office of Early Childhood. We would be open to supporting individuals to learn what our programs are and how they're funded and the nuances around that. So you can count us in as well. Thanks, Joe.
Yeah, and I would also agree, because I think, you know, to some level, even at the state level, we're not even sure of what the interactions and overlap between our own programs are. So I think these sorts of opportunities for us to engage with each other and to engage with our county partners really is a great environment to foster innovation and better uses, more strategic uses of our funding to ensure that we're getting the dollars that are intended to benefit Coloradans into the hands of those people that they're intended to benefit.
All right, with 1 minute left, I'm going to wrap us up. Thank you, everybody, so much. Again, this has been recorded. We will make sure that you get a follow-up email with questions and responses, the recording, the agenda, the PowerPoint, as many things as possible. If you have any trouble accessing those documents because they are in Google, you can just, I'll give you a contact in that email to reach out to so we can send you downloaded versions. Thank you, folks, so much. Thank you to all of our amazing panelists for coming in and fielding random questions from the chat in this virtual setting. We appreciate you so much. And I will stay on just for a couple minutes as folks leave if you need any more questions or have things that you want to add to the chat.
Good job, guys.
Thank
Hey,
you.
thanks for your questions, Lexi.
You bet. I'll just keep asking them until all the services we need exist.
Okay, please.
Okay.
And I'll keep working on it until every service exists.
Okay, good.